What is the difference between cancer in adults and children, and why should treatment approaches differ for them? Explanation for those reading my blog for the first time. In my posts about healthcare, I use statistics from the United States as they are considered the most reliable. Cancer arises from the accumulation of damage in cells, leading to changes in their normal behavior. As people age, the likelihood of accumulating damage increases because the body's protective mechanisms weaken. But why do children, who haven't had time to accumulate damage, develop cancer? From an evolutionary standpoint, cancer develops due to a breakdown in cellular cooperation, which allows cells to unite and function as a single organism. In children, cells are still learning to interact, and pediatric cancer develops when rogue cells appear that refuse to cooperate and grow at the expense of the organism. Adult cells follow a genetic code that determines their functions. During cell division, the genetic code is copied and passed on. Errors can occur in this process, contributing to cancer development in adults. In a growing organism, whose tissues are still developing, there are rapidly dividing cells. They create conditions for cancer development. However, children also have their own protective and regulatory mechanisms that prevent tumors. Children rarely accumulate errors in their genetic code, and children with cancer have a lower frequency of genetic errors than adults with cancer. However, about 10% of cancer cases in children in the U.S. are due to hereditary genetic mutations. Hereditary cancers can arise from errors occurring during embryonic development stages before birth and then accumulate in all cells after birth. Pediatric cancer can also arise spontaneously due to genetic changes different from those common in adults. It often arises from genetic changes occurring in tissues with constant turnover, such as the brain, muscles, and blood. These changes in the genetic code disrupt cellular instructions, leading to uncontrolled division, ultimately resulting in cancer development. In children, cancer is often more invasive and aggressive than in adults, and its treatment can significantly impact a child's development. Approaches to treating cancer in children differ from those for adults. Standard therapy includes radiation or chemotherapy, which affects both cancerous and healthy cells. However, in children, the side effects of these treatments can be more pronounced due to the active growth and development of their cells. Additionally, pediatric cancer has fewer targets for drug therapy, making the development of effective treatments challenging. One reason for the failure of cancer treatment in children is the adaptation of cancer cells to evade treatment and become drug-resistant. Applying principles of evolutionary biology in cancer treatment can help address this issue. For example, extinction therapy involves destroying all cancer cells before they can evolve. This is achieved by using a first strike that kills most cancer cells, followed by targeted intervention on the remaining few cells. If complete eradication is not possible, the goal is to prevent treatment resistance and tumor progression using adaptive therapy based on survival competition among cancer cells. Thus, treating cancer in children requires specific approaches considering the growth and development characteristics of their cells, as well as the application of new treatment methods based on evolutionary biology principles. In recent years, a new treatment method called dynamic on-off switching has been developed. This approach maintains tumor stability while allowing therapy-sensitive cells to overcome competition and suppress resistant cells. This method helps preserve healthy tissues and increases survival chances. Despite the fact that the prognosis after cancer treatment in children is better than in adults, cancer remains the second leading cause of death among children under 15 in the U.S. However, using new methods and a slightly different strategy than similar treatment in adults can improve outcomes and recovery chances for children not only in the U.S. Ultimately, this can improve the prospects of young patients, providing them with a bright future free from cancer.